Now I'll pass it on to him to talk more about this.
All right, thank you, Dia and team, for giving me this opportunity today. So I wanted to just kind of bring more awareness to all of you in how, in this current global climate that we're dealing with, where we are also at risk for kidney disease and kidney health can be impacted severely. So I'd like to share my screen. Let me know when I'll try that now. All right, can you guys see my screen?
Yes, we can see your
Okay,
screen.
perfect. All right, so kidney and climate have a very close connection. As you all may be aware, as we're dealing with global warming, there are extremes of weather that we're seeing in the entire world these days, where there's heat waves, where there's flooding, et cetera. So there's temperatures even in California are not the same as they used to be. At least for myself, I feel every winter has gotten colder, and summers have been sort of hit or miss. But again, I wanted to sort of talk more focus about the heat wave and heat conditions that lead to kidney issues and want you to just be aware of those. And a couple of things that we need to be aware of that heat can impact is the first and foremost is acute kidney injury. That's a reversible form where it can last up to 3 days. And once you fix the underlying issue, usually dehydration or infection, your kidneys will go back to their normal state. Chronic kidney disease, on the other hand, is the word chronic, means something that is there. It's irreversible, and it's there in terms of kidney damage that has happened over a period of time, potentially. And then kidney stones, that again also can happen when you are dehydrated. As I think Aditi mentioned, she wants to drink more water. I would reinforce that uh, as a New Year resolution for all of you. Um, So climate change, rising temperatures leads one to become more concentrated. Their blood becomes more concentrated. You are at risk at that point for kidney stones and then kidney disease. Um, at the same time, if you have an infection, say you get pneumonia and things like that from air pollution, etc., that itself could cause problems to the kidney. And again, usually it'll be acute kidney injury, which is the reversible form where you are fixing the underlying cause. Kidneys are one of the first organs that gets affected by any other process in the body, whether it's heart disease, whether it's infection, whether it's dehydration. Kidneys usually do get affected at the as one of the first organs, but they are resilient in terms of bouncing back and trying to get back to their normal state. Now, wanted to just kind of highlight a few things that we do need to be aware of how what impacts the kidneys or how the heat harms the kidneys. And dehydration is number one, and that's where you start feeling, thirsty, potentially fatigue, and in severe cases, you can end up in the hospital even from, say, food poisoning, or you get a virus where you have a lot of nausea, vomiting, and diarrhea, and you're not able to take in anything orally, and unfortunately you end up in the hospital with severe dehydration. Uh, Segue from that is electrolyte imbalance. If you're dehydrated in general, you can have problems with low potassium. That comes through vomiting or diarrhea. You lose salt as well as potassium and other electrolytes and minerals like magnesium and phosphorus. Again, if they're severe enough, they can cause heart issues, and that can also lead you to be in the hospital. At the microscopic or the cellular level, heat can also cause inflammation at the kidney level, and that damages the kidney unit called a nephron, and that eventually can lead to kidney problems. As I had mentioned before, kidney stones are very often seen in individuals that unfortunately have a reason to develop kidney stones, but more importantly, dehydration is a very big risk factor. It doesn't matter what type of stones you end up getting, but getting dehydrated is the number one reason for developing or worsening of kidney stones. So hydration, hydration, hydration. This slide is a little busy, but I'll kind of just go starting from the left side and work my way to the right side. So, you know, the heat leading to acute kidney injury. Again, acute kidney injury means it's reversible, right? It's acute. And so data analytics have shown that there's a 63 or 62% chance of you developing acute kidney injury in severe heat if the temperature is above 63 degrees Fahrenheit, which is equivalent to 17 degrees Celsius on the screen that you're seeing. And obviously, 32 degrees Celsius is about 89 to 90 degrees Fahrenheit in temperature. And so if you're at 90 degrees temperature versus 63, you have a 62% chance of getting acute kidney injury. And this tends to become a bigger problem when you have, say, a 7-day heat wave back to back. And the risk increases by every 1 degree of Celsius rise above 17 degree, that you're at risk for kidney injury. Now, hydration obviously is very, very crucial to that, and I'll talk about that in further slides. But if you're also not drinking enough and losing heat, through heat, you're losing salt and electrolytes, your muscles become fatigued. And also individuals that are, working outside, or athletes that are participating in the heat, or even military individuals, they're obviously, including with the elderly, are the vulnerable population that can get affected by heat so much more severely than maybe the general population. The mechanism involved, so dehydration, when you don't have enough water in your body, you're going to have decreased blood supply to the kidney. And that again is reversible, providing you can get hydrated. And again, it's 1 to 3 days. Now, the muscle fatigue and not getting enough nutrients to your muscle or blood flow, that causes muscle breakdown. We see a lot of patients sometimes who've just started going to the gym, and they do a vigorous exercise and they don't take enough hydration, and they end up in the hospital and they're urinating literally brown or Coca-Cola colored urine. And that is a sign of that your kidneys are very dehydrated and you have to get to the hospital. And that is usually reversible, providing you get there on time and get rehydrated. And then at the cell level, mitochondria, it's the unit, the functioning unit of the cell. If that is going to be affected by dehydration through the heat mechanism, you're going to develop eventually cell death. And once the cells die in the kidney, you cannot reverse them. At that point, it becomes irreversible. And on the extreme right here, you have heat stroke, and that is obviously severe dehydration with severe inflammation. And you have inflammation everywhere because cells are dying, and your body has a way of mechanism trying to get rid of those dead cells, but also trying to, conserve energy and blood flow. In the very bottom of the right-hand corner is a disease progression. So you start out with acute kidney injury, which again is reversible. And then you have cells that are attacking and leading to inflammation. That starts becoming partially reversible. And then you start losing the kidney unit, the nephron, the cells. At that point, it becomes irreversible. Fibrosis is scarring, basically. You cannot reverse kidney scar. And that leads to chronic kidney disease. And eventually, kidney failure, which is called end-stage renal disease, when you have to start dialysis. So the clinical impacts through the weather and the climate, where heat leads to acute kidney injury, that is itself a risk for hospitalization. Chronic kidney disease is also most commonly seen in places where there is higher temperatures. Mesoamerica used to be a term that was attributed to southern part of Mexico, Costa Rica, Honduras. These countries tend to have higher temperatures, and therefore they have a higher incidence of chronic kidney disease. And they're, again, because of higher temperatures, and now with global warming, they're even at higher risk to develop kidney issues. As I had previously mentioned, kidney stones obviously are there, and they're very painful. They usually end up, when they get lodged in your ureter, which is the pipe connecting the kidney to the bladder, you end up in the hospital because you are in intense pain. And once a stone is stuck there, you need either surgery or sometimes just lots of hydration and pain medication. And again, that's also in the setting of dehydration. And individuals that already have pre-existing chronic kidney disease, for them in the setting of severe heat, they are at risk for increased hospitalization and obviously developing acute kidney injury superimposed on their chronic kidney disease. This next slide here just kind of has the spectrum from chronic heat exposure to heat stroke. So chronic heat. So whether there's some individuals in southern Mexico or Costa Rica, those individuals are high risk for kidney and heart disease because of them being exposed to higher heat temperatures. And then heat cramps, as we alluded to before, your muscles get fatigued when you don't have enough blood flow because you don't have enough hydration in you. And that leads to muscle contractions and eventually leading to electrolyte imbalance. And the next severe is heat exhaustion, and that is obviously going to affect your ability to move because you'll have so many cramps, and because of the electrolyte imbalance, you may also have heart arrhythmias. Your heart can go into cardiac arrest. And then the most fatal and the least and the most fatal in the sense and the most extreme is heat stroke, where it's life-threatening if you do not find a hospital or an urgent care quickly. That is a time where you're now playing with fire and you're going to lose cells, blood supply to the brain, to the heart, and obviously the kidneys. So again, very important not to get dehydrated in our summer weathers. And if we live in the, places where it's more humid and other places where it's just higher temperatures. Wanted to elaborate a little bit on populations that are at more risk than others. So individuals, so first and foremost, elderly adults, they are at higher risk because they're likely taking medications for diabetes and or for high blood pressure. And so if you put this population in a setting of warm, hot weather, some of the medications that are used for blood pressure in the setting of dehydration can actually harm the kidneys. And so if you're dehydrated and you're taking these medications for blood pressure, these medications being a double-edged sword can actually harm you. And therefore the elderly are at more risk to develop, kidney issues. And individuals that already have pre-existing heart disease, 25% of what our heart pumps goes directly to the kidneys. If your heart is not working at capacity, and then you add an insult like increased temperatures, you are at risk for developing kidney issues. And individuals that already have pre-existing kidney issues, they're obviously at even higher risk to develop further kidney worsening of their function and leading to eventually, kidney failure and dialysis. Military personnel and, athletes, they do a lot of strenuous activity in the heat. And for them, and along with outdoor workers, they are three different individuals that are very high risk for developing, heat exhaustion, heat stroke, etc. And for especially in hot, again, and this is all in in the setting of hot temperatures. Children also can do this. I mean, children, don't sometimes know. I'm talking about the younger children, ages 5 to 10, possibly. They're not aware. They're just playing and having fun. Yet in higher temperatures, they're at high risk as well to develop kidney injury. Wanted to briefly just talk about prevention and what else we can do to help in terms of strategies. Obviously, there's different levels, right? The individual level, the healthcare level, and then the policy at the government level. Individually, we all hear, hey, hydration, take breaks if you're going to be outside in terms of hot temperatures, wear loose clothing, avoid peak heat temperatures, especially, late morning, early afternoon. That's when the temperatures are usually scorching high. And for the healthcare providers at the level we are, to provide education, counseling, awareness to patients that we see, that this is something that you can at least help yourself. And given that we are trying our best as the world in terms of trying to slow down global warming, but there are things that we can do to make sure we are hydrated. And then at the government level, just global warming. I mean, climate change is there. We're seeing that. I mean, some people don't believe that, I guess, but at the same time, improving working conditions for individuals that are going to be outside, provide rest, provide shade, obviously more water, and then address climate change. These are things that we all need to do together. These are just some of the tips, starting from the left-hand side. Obviously, having water available to you is very crucial. Having maybe a fan or having an air conditioner, depending on where you're working, dressing down in terms of, loose clothing, even taking showers if you're going to be outside, if it's possible, having a shade, wearing a hat, trying to eat more foods that have, that prevent against dehydration, like salads, fruits like watermelon. Those are all, have electrolytes, and they actually tend to slow down dehydration. And then avoiding alcohol. Alcohol in general is a dehydrating agent. You might be surprised tea and coffee are there. Well, tea and coffee they have caffeine in them. Maybe not a lot in tea, but it's there. And tea and coffee having caffeine, they cause you to urinate more. Therefore, you lose volume, you lose electrolytes. So you want to avoid even hot and spicy food, because when you sweat, especially with hot, spicy foods, you're going to end up needing more water. And salty food. Salt actually causes craving of more water. Your body needs more water when you take in salt. So those are things you want to try to avoid if it's a hot day, and try not to risk dehydration. This picture is from Hurricane Katrina. I presume this was before all you guys were born. This was in 2005 when I was doing my training in Atlanta, and this was in Louisiana, where you can see floods happen and houses are submerged. It's very catastrophic. A lot of people lost their lives. This impacted me because while I was training in Atlanta, patients, because of the flooding in New Orleans, dialysis patients had to be displaced because dialysis units could not do the dialysis because of flooding in their dialysis clinic. And when that happens with the flooding, there's water contamination. We need a clean water resource of supply to dialyze patients. So patients were displaced. We had a few patients that had to actually come out and get dialysis in Atlanta for a couple of weeks till their units were, repaired and fixed. And we actually even had training fellows that were having to move because their hospitals were affected with flooding. And so they had to move their training and come to Atlanta for a few weeks to months, so they didn't lose out their training time. And so this particular event also was attributed to global warming. Analytics have looked at it, and they showed that climate change in this particular situation in 2005, Hurricane Katrina was much intensified because the ocean waters were 1.6 Fahrenheit warmer than they should have been. And they attribute this to global warming. And even the increased winds that were there during this hurricane, they were 5 miles per hour faster than usually expected for that category hurricane. And that was also attributed to climate change. Just wanted to bring a couple of things to your awareness about dialysis. Dialysis, hopefully we wouldn't, dialysis is not a death sentence. It's a life-altering event. It is when your kidneys have failed to a point where you need a machine now to take place for the kidneys. Now, dialysis in some people can be temporary, providing you can fix the underlying problem. And again, if not, then you end up being on dialysis, usually going to a center 3 times a week. And dialysis is basically a process of filtration of your blood, which your kidneys are unable to do because your kidneys have now gotten to a level where they're not able to service the body. And to remove the toxins that your kidneys are now not able to eliminate, that's what dialysis does. This is just a dialysis clinic with various machines that you may be able to see where patients are, attached to them. There's a circuit and a blood port going in and out. So this is again called hemodialysis. This is dialysis that you do usually in center. You go to an outpatient clinic. There's also home dialysis called peritoneal dialysis, where you put fluid in your belly and do it while you're sleeping at night. The machine does it all for you. So I just wanted to kind of, make it a little more interactive amongst us. Just a simple question, any of you can answer. I mean, what matters most in heat? Do you think energy drinks are better than water breaks? What do you guys think is the better option here?
Water
Water.
breaks.
Thank you. You guys are listening. Okay. If any one of you can just tell me one way climate change that you've throughout this presentation affects the kidneys.
Extreme heat.
All right. Any others?
Not drinking water.
Right. I mean, but again, so yeah, floods and all that leading to that. But yeah, you're right. Uh-huh. But yeah, floods and heat. It's just the climate itself, right? So how would you protect athletes in a heat wave?
Make sure they're getting like breaks in between, like
Right.
their practice.
Any other ideas? So you want to make sure, obviously if it's scorching heat, I don't know if you guys follow tennis or not or other sports. I mean, Australian Open. So Australian Open is starting now. It's very hot in Australia right now. And so some of the stadiums do not have roofs. So sometimes they have to reschedule the matches because it's very much unsafe for individuals. And you'll sometimes even see that they're cramping. It's cramping because they've lost all this salt and electrolytes, even though they're trying to keep up with whatever Gatorade, water, whatever they're doing. But the intense heat and the strenuous exercise they're doing while they're playing leads to that. And then obviously, wear cool clothing and things like that. And then shade will be the best answer as well. So who's most at risk out of the ones here? We got the elderly, we got the individuals with chronic illness, outdoor workers. Any takers there?
Aren't all of them?
Yes. Thank you. I wanted to make sure someone said all of them. Yes, they're all at risk. Yes. So how do we protect kidneys? Kind of talked about this. Hydration, taking breaks, especially if you're going to be outside. Obviously, pollution. If it's smoky out there, the air quality is not good, and you have asthma and other things, that can actually trigger kidney problems. So you got to be vigilant. If the air quality is not good, stay inside the home because you can develop inhalation pneumonia. You can develop other breathing issues, and those can indirectly be detrimental to the kidneys. So key takeaways. One thing you guys learned.
To drink more water.
All right. Okay. And one action to take.
We can also tell others the importance of drinking more water.
Right. Awareness, counseling others. And just protecting the planet protects our health, and obviously kidneys are a very important organ in that connection. So we want to make sure we really do keep ourselves in terms of trying to protect the planet so we can protect ourselves as well as the kidneys and other organs. So, I just wanted to wrap it up by saying that, this is as we know, climate change has many issues that it can affect. From my standpoint, it's a significant kidney health threat to us. It can create a lot of issues for us. It can lead to a lot of patients or people end up in the hospital. And last thing you want to do is end up on dialysis, which is not fun. It may be reversible if you catch it early enough, or you end up on dialysis for the rest of your life unless you can get a kidney transplant. And obviously, more awareness at the government, at the national level, we need to continue do that and make everyone aware, the policymakers, the healthcare system, and the individuals. Trying to do the best you can. Prevention is a cure in some ways. We may not be able to fix global warming altogether. We can try, but being aware and trying to, get our local leaders, our national leaders to be more aware to try to help with the emissions and fossil fuels and all that. I mean, that's what we all need to do together and unify and try to help our future generations.